Welcome, everyone. I'm Dick Deming. I'm Medical Director of Mercy One Cancer Center, and I'm the founder of Above and Beyond Cancer. Welcome to our weekly cancer education series. It's brought to you in part by a grant from the Iowa Oncology Society. And tonight we're going to be talking about massage therapy as a healing
Yes.
art for cancer patients.
Yes, thank
So
you.
welcome. This is Cassie Sampson.
Hello.
And Cassie is a licensed massage therapist and the owner of East Village Spa.
That's correct. And I'm here to bust some oncology massage myths.
Okay, well, good. But before we do
Yes.
some myth busting, let's learn a bit about you.
Sure.
So you're from Iowa, right?
I am from Iowa my whole life.
And grew up in
Bettendorf, the Quad Cities. Yes.
So what was your claim to fame in high school?
This one is easy. And let me please indulge with a brief story. So I was a swimmer my whole life. My old coach, that influenced probably other than my mom, the most influential person in my life, passed away last weekend. And so I have my swim bag in my car for the first time in years. After this, I'm going to go swim laps horribly in honor of Coach Cy. But yes, so swimming was my whole identity and claim to fame.
And
in high school.
Great.
Yeah.
I hope Coach Cy had a long.
He did. He coached his goal. He coached people who made it to the Olympics. He was a very successful coach. So he is probably,
What was your best stroke and your best distance?
Butterfly. I was faster
at
butterfly than freestyle. And the 100 fly was really my only event I could swim because I'm short. I had to do what nobody else wanted. That's it. I wasn't going to be a sprinter. I'm 5 feet tall.
And then after Bettendorf, you went to UNI.
I went to UNI.
Did you swim at UNI? Did they have a swim
program?
No,
I stopped swimming. Okay. I needed a very long break from the pool after that. So, yeah.
So you have your swimsuit. Some of my triathlon gang is doing a blue moon swim tonight.
Here?
Tonight is a super blue moon.
Oh my gosh.
It's an outdoor swim tonight. So I'll connect you with them.
Okay. That's exciting.
So what did you major in at UNI?
Recreation therapy. Okay. After a lot of other things, I settled on recreation therapy.
What was your first declared major when you started at UNI?
Social work.
Okay. And then recreational therapy. And your first job out of college?
I was a nursing home activity director. I loved it. And in college, and we talked about all through college, which inspired me to change my major to recreation therapy, was I got a lucky job. There was a care center looking for a lifeguard in Waterloo, and that's all I knew. I had no idea. It was an aquatic therapy assistant position for a brain injury rehab center. And I was shocked that they would let 19-year-old me do such an awesome job working with residents.
So you ended up not being just the lifeguard, but you ended up being
I was in the pool.
Therapy.
I was doing their therapy that was prescribed in the pool with people rehabbing brain injuries. And it was such a lucky break, and it shaped my whole career.
And at what point did you then transition or get a license in massage therapy?
So I worked in long-term care about 5 years. And back then, so this was the early 2000s, my dream was to get my massage therapy license. So I went to school full-time while working full-time. And my hope was that I would be able to work in long-term care doing massage therapy. But at the time, the thought was, well, that's nice. You can volunteer. Now we have hospital systems and organizations, and seeing massage in, a lot of the bigger healthcare systems in long-term care is normal, but it wasn't then. So I left.
So massage therapy was thought of as kind of this exotic thing that
and you learn this nice thing, and you will do it for free because you like, which I do enjoy it, but it wasn't something that there was money for or budget for, or people understood why this would be helpful. So.
And then you're also an entrepreneur and a business owner. And tell us a little bit about your business.
I own East Village Spa, and I opened it in 2008. I couldn't find a place I enjoyed working as a massage therapist. So I tried working on my own. and I did not like the isolation. So I tried to go back to school. I went back to get my master's in public health at Des Moines University, and then promptly realized I don't like this. I I so I decided, well, what I realized is I really love massage, and grad school seems like a very expensive hobby. So about halfway through the program, I thought, I don't want to leave massage therapy, and I should probably stop this hobby. So I went from my own practice to opening a small spa, and it grew and grew and grew. I didn't mean for that, but we're at 6,000 square feet and a team of 30 downtown in Des Moines.
Wow.
And I love it. It's
And
my
how
dream.
many licensed massage therapists do you have?
We have about 15 licensed massage therapists, including myself, my spa director. We have most of our licensed massage therapists are full-time. We have some that are part-time. Mm-hmm.
And how has massage therapy changed since you've gotten your license? We already talked about it's becoming more recognized as a part of a medical program, not just something you do as fluff, but that can actually be important in terms of health and well-being.
The biggest change, I think, is just the more people. So I've had my license 18 years. The more people who have tried massage, the more people who continue to get massage. Once people try it in general, if they have a good first experience, they see the benefit and they continue using massage. And the pandemic, I don't like to keep bringing it up, but my business was shut down for 3 months and then another month later. So during the pandemic, I think is when we really saw spas, massage therapists, private practice, how much people were demanding touch. And I was afraid people wouldn't come back, that nobody would come back for massage. And I was wrong. And the industry lost a lot of people. There's a lot of women doing this, a lot of people when the industry had to shut down. We're rebuilding because schools had a hard time, but we're rebuilding, and the demand has skyrocketed since then. So I think losing massage therapy for people showed them just how much they want it in their lives. And I own a spa. I've always been a little more medically oriented, very evidence informed. Our guests largely are seeking we call it targeted therapy, but a more orthopedic, pain relieving approach, something for their regular health care. So yes, we're a spa. They both come to relax and get regular treatment to maintain their day-to-day living.
Tell us a little bit about what the education curriculum is to become a licensed massage therapist.
I'm glad that you asked. In Iowa, so they're working on an interstate compact. It's not great. It's not going as well as some other health professions. So our licenses, first of all, are not portable state to state. All but I think 4 states are licensed. Thankfully, Iowa is. To get a massage license in Iowa is a minimum 600-hour training program, and that's clock hours. It doesn't work like a college program, and they're all different. Minimum 600 hours. Most therapists go way above that.
And do the training programs have to be certified by the state?
No, it is optional. They can voluntarily submit their curriculum for approval, but the programs themselves, to be able to sit for the national boards, our testing authority, the program has to be approved for their students to sit for the national boards, and that's an exam security issue.
Gotcha. So even though there isn't a national licensing, there is a national certification body.
There is, but it doesn't. So it's such good questions because every profession is different, and it's important for people to understand. So when you graduate from massage therapy school or get toward the end, you would sign up to it's called the MBLEX, take your national exam, and then they send that to the state that you're in. Now, if you are in Iowa where we have a license, that's great. Then you pay, and it's really a small fee to stay licensed in Iowa. It hasn't changed since I have been licensed, but then you maintain continuing education. The state board.
Can you be licensed in Iowa without taking the national exam?
No. So the national exam is required by states. there may be a state or two that has an alternative, but I don't know why they would.
Mhm.
So that federation that has the national exam works with state boards. That there is another national federation, so somebody could become nationally certified through that. But the only reason that I would consider doing something like that is if I moved to Minnesota, where they don't have licensing. And I've thought that, like, what would happen if we didn't have licensing? How would I even employ people? Because they would have to go through all these hoops, and then I'd be responsible.
Mm.
Our clients would be responsible for vetting everyone. I would rather just have them know that if you're a licensed massage therapist, you have met the minimum standards set forth by the state.
And talk a little bit more about the education. Like,
Mhm.
do you go to a school where you're in
Yeah.
a class with 30 other folks and you have classroom
It
activities and
Mhm.
science and physiology and anatomy, as well as the practical aspect of massage?
So these are really good questions. It's all over the place in our field. There is a set, there's set minimum standards of curriculum that the state maintains. So there is anatomy, physiology, kinesiology, pathology. There's the hands-on classes. Not all programs are designed the same. I took a program that was about 900 hours 18 years ago. Most of the employees I hire have taken anywhere from 800 to 1200 minimum initial training hours to even start to be qualified for what our clients expect. So you can specialize, and that we'll talk a
Mhm.
little about tonight. So if you have a passion for working in oncology care or working with seniors, which that's near and dear to my heart, a passion for working with athletes, infants, pregnant women. There's all kinds of paths where you can specialize. And then there's general, learning the basics, how to safely provide massage therapy. But ethics, business, I taught business for a decade. It's so important because a lot of people go into these fields because they want to work independently or
Mm.
work for themselves. So that's kind of the baseline. But it's the school I attended is local central Iowa. As an employer, I'm very lucky to have such a good program here. There's a few good programs around, but some are small where they might only have 6 therapists going through together the whole time, one teacher, same curriculum. I was lucky to have teachers flown in from across the country that specialized, and I could work full time and take, this class. We're flying in this teacher, so it's a week straight. Got
Gotcha.
it. Yeah.
And when you're in
A lot
school,
of students to work with, touch, trade.
do you work on each other as
Mhm.
your first clients?
Yes.
As students work on each other, and
Mhm.
then do you do like internships where while you're in school, you might be working as a student in a
That's
spa or in a
a
center that does
That's a
massage?
great question, and it's like a confusing thing. So legally, how it works is we work with each other in school. So the bigger your program, the more students, the more bodies, the more ages, the more health concerns you get accustomed to in class. So that's a huge benefit. Then you do your school clinic. So there is a required number of hours, set a minimum number of hours set forth by the state. Each education program is different, where you're in a supervised clinic. So if you came in, or any of you here as a member of the public, to get a massage at one of the schools, the students would be working on you. The supervision is going to be different depending, but the students have to do a minimum amount of training before they legally, ethically, safely can work on the public in a supervised manner. So then as they add those more intensive courses, like maybe it is learning Thai massage, maybe they're learning hot stones or lower body sports massage, they are working with the public and get to start integrating these new techniques in as appropriate. So it's a really good way to take the information and really synthesize it. Now, internships outside of the school, that's not allowed. I've heard of people getting really confused saying, well, I'm working under somebody's license, and you can't do that if you don't have a license.
In the state of
That's
Iowa,
not
right?
okay. Yep. Yep.
Okay. And you mentioned some specific techniques. So,
Mhm.
um, Let's talk a little bit about besides the technique that most of us might think of with massage is the massage therapist using their hands.
Yeah.
What are some of the other techniques that have come into
Okay.
the field of massage therapy?
Well, when you said besides the therapist using their hands, you gave me an interesting in, and I don't know if this is something we do, but ashiatsu massage with our feet.
With your feet, where
With
you
our feet,
walk
we
on.
do that.
Okay.
Not every therapist. So, and we'll talk, not every therapist does every kind of massage, but we do. We have 2 rooms with bars. The bars are not for us to swing from or hang from. They're so we don't fall on somebody and embarrass ourselves, but we use our feet like we would our hands, and they sliding and gliding. There's some compression. So it's not like when you have your kids,
Right,
walk on your back, which our
And the
clients always,
bars support some of your weight.
they can. They shouldn't, or
Oh,
you'll hurt yourself. Like you'll hurt your
Oh,
shoulders.
okay. So your whole weight is on.
One of your feet is typically on a table.
Okay.
I speak for myself. I feel like I can do a really good one when I'm not running if I'm taking care of my feet. Like right now, my calluses would exfoliate you.
Okay.
But if I'm doing that, one of my feet is on the table and I am not graceful. But I have some therapists who do this, who have a background in dance. And I mean, watching them do this massage is just beautiful. And I think, well, this feels good to my clients, but I don't want them to ever see a video of me doing it. But no, it's this great flow. And the point of it isn't novelty. It's that your feet are bigger than your hands. So simply, you've got a broader surface. And it's just dispersing the pressure. So if you want heavy pressure and I come in with a bony elbow, that might leave you more sore, more inflamed, more irritated. Now, if you like heavy pressure and I'm working on your legs with my foot, it is going to be this softer, even pressure dispersed slowly. So you get the depth without the sharpness, if that makes sense. So that's one technique.
And what's that called?
Well, it has different names. Some people call it ashiatsu.
Okay.
Like shiatsu is pressure like finger. Ashi is your feet, so foot pressure.
Okay.
But that would be the easiest way for somebody to search for that technique. But oh my gosh, you've got using heated stones for people who like that deep feeling of heat, but maybe not the pressure. The heat penetrates deeply. You've got sports type massage, orthopedic massages. I mean, gosh, there's
And what
so
about gizmos
many.
and gadgets?
We do have gizmos and gadgets. I'm more old fashioned in that I like to use my hands. And then sometimes of year, I like to use my feet. And I'm good with that. But, people have been enjoying cupping therapy. We do both depending on the therapist. But the silicone cups that you see, and you see they call them the cup kisses, the silicone cups. So the point of that is it kind of suctions the tissue up. It's very good myofascial. I don't leave them on people so much as I use it to lift the tissue and gently pull. So what you're thinking of, instead of just squishing down your tissue and pushing it in, it's a different way to massage. You're kind of lifting and separating some of the areas that are more restricted. So that's an interesting thing.
And what about vibrating devices?
We don't tend to use those at the spa. I know at home I do.
Okay.
There's a few like on my shins. Like not on the bone, but yeah.
Needles, dry needles?
That is not okay in our license.
Okay.
So, but we're big fans of physical therapy at East Village Spa. We know when we're not always the answer. So we have a network of trusted physical therapists, acupuncture. We'll refer out when we're not the answer.
Some of the techniques, I think, are done by physical therapists as well.
Exactly. The physical therapists and chiropractors can do soft tissue manipulation, but it's a really bad use of their time. We have, as a massage therapist, we can spend an hour and a half with somebody because you can't bully your muscles into relaxing. Like if I came and shook you and was like, Dr. Deming, relax. That's not relaxing. You have to gently like soothe your muscles into, I think a teacher told me once, you can't inflict relaxation on a muscle. So it's a slower process and a massage therapist has time to do it.
Right.
Yeah.
Okay. So over the course of your career as a licensed massage therapist, and certainly over the course of my
Mhm.
career as a cancer doctor, now we have brought massage therapy
I love
into
it.
the cancer
It's
center. And
amazing.
as you know, you have visited our center. So
I was very
our
jealous. It's
our
beautiful.
thank you. So our integrated medicine program for cancer patients includes physical
Mhm.
therapy, chiropractic care, massage therapy,
Mhm.
osteopathic manipulation, and acupuncture. Um, so we certainly recognize that there are evidence-based treatments done
Mhm.
by massage therapists
Yeah.
that can definitely improve quality of life for cancer patients.
Mhm.
So let's talk a little bit about oncology in particular. Um, there's a separate certification or an additional certification, or
Yeah.
there are training courses for licensed
Yes.
massage therapists to take that gives them more experience and education about the pathophysiology of cancer and maybe
Mhm.
some other important pieces
Yeah.
of knowledge that are good when you're working on cancer patients.
Absolutely. So this is a really good one, and I'm just going to say this is one of the myths we'll
Okay.
bust is the certification myth, and I think this is not unique to massage. Certification in something simply means you have a certificate. So that could mean that I took a 1 hour class online for my continuing education and got a certificate. It could mean, like your therapists here have done some intensive training, many at the Mayo Clinic. There are some amazing programs to learn more about the pathology of cancer and how to safely apply massage therapy for people at any point in their cancer experience, from having cancer, receiving treatments. It might be years after they've been deemed cancer free
Mhm.
because we know the impacts on the body are lasting. But the training path to that looks different. There's no standardized way to get there. And, I've had on my team people who came from a healthcare background, and I've worked in long-term care. I've had nurses. Massage therapy is a great career change field. Nurses go that route. So they come with a different background understanding in cancer. We've had people whose lives have been touched by cancer, having a loved one with cancer. So their knowledge base is different. So the path to understanding the best way to use massage therapy with people who have cancer looks different. The most important thing for patients would be to get trusted referrals and ask some questions about their knowledge.
Right. And in our center is it's integrated in the sense that the
Mhm.
massage therapists, before they even meet the patient, will have talked to me and we've gone over the patient's history and whether they've had
Mhm.
chemotherapy, whether they have surgery, radiation, and kind of what some of the medical issues
Right.
are.
Mhm.
I appreciate the knowledge base that you all have about anatomy and physiology, and then the experience
Right.
that you gain about cancer. As you said, it can be either through a training program, through family members that have had cancer,
That
through
was
just your
mhm.
career taking care of patients who've had
Right.
cancer.
And I thought that I knew a lot. My mom has survived both ovarian and breast cancer, and she survived breast cancer. She finished her treatments in 2019. So I was very relieved that it was before 2020. And I did think I knew quite a bit, but seeing firsthand how the surgery, the radiation, the chemotherapy, and how it still affects her.
Yes.
She's 70, and the medication she takes, in her experience, she's not local, but with finding a massage therapist now is really hard because the therapists she saw before weren't really willing to modify their technique. And that's okay. Not every therapist does every kind of massage, but that made me research more and better understand so that I could be more flexible. And we've watched employees go through cancer and see what they needed. And seeing that firsthand too really does impact your empathy and your willingness to research and better understand how to help clients with diverse needs.
Just out of curiosity, did your mom have genetic testing done?
My mom and I both did. We have a variant of unknown
Okay.
significance. So this is one reason why I've been doing more of a deep dive personally. I've always had an interest in this. At our spa, our motto is everybody welcome. and including people who are having medical challenges is a part of that. But it's very scary. My dad survived having melanoma at 20, and we don't know. My mom's adopted, so trying to figure these things out.
Mhm.
I think people watching this maybe also have that experience if your loved one has cancer, feeling like, am I a ticking time bomb?
Right.
And so trying to understand, visiting your cancer center was like, what are the options out there if this happens? Because I face fear with knowledge. So I'm trying to understand, if this would happen, what are my options?
Yes. And every woman with ovarian cancer should have genetic
Exactly.
testing,
Yep.
and the combination of
Mhm.
ovarian cancer and breast cancer really is
It
a flag about the
very impactful.
potential genetic mutation.
Mhm.
Um, so one of the reasons that we brought massage therapy as a part of our integrated practice in the cancer center is many of the treatments that patients go through, surgery,
Mhm.
radiation, chemotherapy, they're great at getting rid of cancer
Mhm.
and curing a patient, but they do have consequences.
Absolutely.
And some of those can be long-term and
Mhm.
lifelong consequences.
Mhm.
What's been your experience with cancer patients and some of the issues that they've come to you for? And
Yeah.
what do you think that massage therapy is best able to do
Mhm.
for cancer patients?
This is a really good question. Early on in my career, I focused heavily on lymphatic massage. I had 100 hours of training, and I thought, this is it for me. When our clients come to us for that now, I tend to refer out more to physical therapists who have certifications and can do more to get things under control. So, for example, throughout the cancer experience, might be, as you know, and please correct me if I misspeak, because we're myth busting and I want you if I misspeak. Um, but it could be years later when somebody starts presenting with lymphedema. At that point, we have had people ask us for help. I would rather make sure that they go
Mhm.
to a manual lymphatic drainage expert, somebody who has taken, there are some good certification course when I talk about
Right, in
certificates in
lymphedema.
that. And I feel
And
like
often we're talking about
mhm,
a woman who's had breast cancer
lymph
treatment,
nodes removed.
surgery with lymph nodes removed,
Mhm.
radiation, and swelling of the
Yeah.
arm.
Yes. And that's something that we watch for. And occasionally people will ask their massage therapist as the first step. Now, my preference would be to get them reconnected with a doctor, with a physical therapist, and also because of the amount of treatment they're needing. If insurance will cover it, please go that route first. Plus, you might need garments and other advice. There's so much that is outside of our scope. Now, once you get that under control, go on vacation, maybe don't wear your sleeve. I feel like that's a good place for a massage therapist to come in, bring the swelling
Mhm.
down, get your sleeve back on. Other things that people, again, thinking of my mother, the medication she takes, she feels yucky. Her bones hurt. She needs changes in her massage, and not an aggressive touch. I do feel like some of our clients who've had a history of massage or of cancer are afraid. So this would be a myth too, are afraid to disclose that
Hmm.
because they're afraid they'll only get a light massage. They're afraid somebody will be scared. That's not necessarily the case because we have people who've had cancer and they're very healthy and they're doing marathons and they're climbing mountains and they're doing these great things. And there's just a few things we would watch out for. If they have had lymph node involvement, lymph nodes removed or damaged, we're not going to be really aggressive in that area. And we're going to look for things if it's recent, like deep vein thrombosis, if they present with symptoms of something, they have a higher risk of blood clotting. That's an emergency. Go,
Mhm.
you know what? I'd rather have you be mad at me and send you to the doctor or the emergency room to figure it out. But largely, there's some anxiety too. Definitely anxiety, scars, scarring, especially mastectomy scars or any breast reconstruction that is maybe limiting your range of motion. That's something we can work with. We do have some peripheral neuropathy concerns where our therapists will try different approaches, maybe like using, we talked about the tools, blades. It's not a sharp blade, but like
Mhm.
A-stim kind of tools to do lighter stimulation of the nerves to see if they get any result. But it's a lot of trial and error.
Yeah.
But some people, it's just normal massage they were having before cancer.
Yes. You mentioned your mom and going through the chemotherapy. Many patients who are going through chemotherapy or
Mm,
hormone therapy for
mhm,
anti-estrogen therapy of breast cancer have lots of myalgias and
mhm.
arthralgias, meaning
So
muscle
much pain,
aches
so
and
much.
pains that where massage can really
Mhm,
help improve their sense of comfort, relaxation, helps with insomnia.
mhm, mhm.
Um, how about patients who are experiencing nausea? Do you find
Ooh,
that
that's a
a
good
good
one.
massage can sometimes help with that? Do you ever focus on
Mhm,
uh, how would you approach that? If someone says, "Well, I've been getting chemotherapy and I
mm.
tend to have nausea afterwards, and I also have aches and pains." Do you, how would you approach assessing and what you would do for them?
That's a really good question. So, it's going to be different. My first step would be, when do you feel the best? So, if it's we've had, a guest that might come the day before their chemotherapy because they're feeling better by then, so they can get out, they can be in the car. That would be my first step. If they are experiencing nausea, and not just for chemo, I get vertigo. So we tell people, tell your massage therapist, because there's a lot of techniques. We don't all use them, but like with just even a gentle rocking or with moving the direction of your head, tell a massage therapist, I get nauseous. We can modify. There have been some studies for things like foot reflexology or even just things that provide some relaxation and comfort. Scent, I would also want to know in advance if someone was coming in and nausea was a concern, because if scents are bothersome, it's not just us not using a scent or being cautious, but making sure they're in a room. If we have a guest that wears a heavy perfume or is a smoker, I want to know before your visit so I can make sure that you're not in a treatment room where there would be a scent lingering,
Mhm,
perhaps.
mhm. Yeah, that's some places try to create an ambiance with music and with scents,
Hmm.
but that can be a real problematic for patients
Yeah.
undergoing cancer treatment where their sense of smell is hyperacute or
Hmm.
where certain scents can really trigger nausea.
And truly the best thing I could, regardless of the situation, tell your therapist well in advance, because a lot of these things we are happy to accommodate, but some things like scents linger. And so the more notice we have, we can not do or we can have you come in a different door. There's a lot of options we have if we know. Mhm.
One of the most important qualities of a massage therapist for the cancer world is empathy. You
Mhm.
mentioned that,
Mhm.
and the ability for who's ever working on a patient, whether it's our massage therapist or acupuncturist or chiropractor, this sense of empathy and establishing a relationship.
Mhm.
Is that something that is taught in massage therapy, or is that, do you think that massage therapy attracts uh, people who tend to be more empathetic?
Massage therapy attracts empathetic people. Sometimes empathetic to a fault, because it is a challenge in our field, because for some people it creates a burnout because they feel so hard, and they care so much. And so it really does attract somebody who cares. That said, I don't think you can teach empathy. You have it, or you don't.
I
But
think you
I
can
think
teach it.
maybe you can develop it more.
Yes.
You can finally develop it more. But I do feel like our profession is a profession of people who care. I think that if somebody has an experience with a therapist and it's not the right fit too, because you're in close close space, and we even have therapists who have had clients who are very, very, very nice, very kind, and they're like, I don't think I am the right fit for for this um for this wonderful person, but I think that so and so is going to be a much better match. But no, there is so much trust, and we hear a lot. We maintain the confidentiality, but as soon as somebody starts that touch, and I think the first massage I got after being closed for 3 months during the pandemic, and not touching people that aren't your significant other, it was just almost this emotional, and we saw that too. And oh my gosh, all the feelings, that was just a period of feelings. But same with
Yes.
cancer care, and the touch that you get isn't always nice. I know, like, IVs and things that don't feel good. And so then you have somebody who's touching you in a way that's just purely to feel good and
Right.
to care. And that's very emotional, and that's heavy for us too.
It is, and it works in both directions. You mentioned during the pandemic. I remember so clearly saying, I don't know, I probably have been saying it for years before the pandemic. I said, if it gets to the point that it is forbidden for a doctor to give a patient a hug, I'm out of here. And then all of a sudden, it became forbidden for people to hug.
Yeah.
Now, some patients still sort of demanded that, and with informed consent and a willingness, but the importance of the touch. And in practicing medicine, there's the touch of the physical examination, which can provide healing even beyond, listening to the heart, listening to the lungs, examining the abdomen. The act of touch, it can be healing.
Oh my gosh. Yes. Yeah. I mean, for us too.
And for the practitioner as well.
Yeah, and I think that too, with the time closed, some of my people did not do well. And it was because they too were starved for touch. Not our clients, but some of the providers, because that it does go both ways, what we do. It matters a lot to us, not just the people we work with.
So, Cassie, you said that one of your objectives to this evening is to bust some myths.
Yes,
So
please.
what are some of the myths about massage?
Well, we also, therapists like hydration. Number one myth is that if you have cancer, you cannot get a massage. And I think you're doing a great job to bust this myth, because I can just say, well, the Cancer Center offers massage therapy at no charge for people receiving cancer treatments.
Yes. Yeah. And as you pointed out, you're trained in an evidence-based method, and there's a lot of evidence that shows that massage therapy can be an important part of health and well-being.
Right. And just because massage in general is safe for people who have cancer when performed by a therapist who has advanced education and training, that's not a uniform standard of certification. But if the therapist understands, is willing to ask questions, if your healthcare team is informed, there's a lot of benefit to getting massage. But the challenge is, you can't assume every therapist is a therapist who is comfortable or safe to provide massage for people who have cancer. And part of the reason for this myth is that there are some of the larger franchises, or some businesses do have a policy that's, we can't work on somebody who has cancer. And honestly, that's okay, because to me that signals this is just not something that we're trained in. And if somebody says we're not comfortable or we're not trained, there are plenty of people who are. So
I didn't realize that there's some.
There are places that will not massage women in their first trimester. It is totally safe for women to get a massage in their first trimester, right? But the fear is correlation and causation.
Gotcha.
So that is why it is not unsafe to massage a woman in her first trimester, but businesses just get a little nervous. That is been a frustration. Some of the people I've hired at my spa are like, so we can work with our our guests once they get
I
cancer.
see.
And I was like,
So the thought is
absolutely,
that if you did a
absolutely.
massage and the woman happened to have a miscarriage,
In the first,
that
where is
that you
statistically more likely in the first
right
trimester.
that you might be accused of having
Exactly.
been
Yeah. And
contributory to that.
yes. So
Okay,
that is part of why this myth
gotcha.
exists. Mhm.
Okay, myth number 2.
Okay. Number 2, massage can spread cancer.
Oh,
Mm.
so
I,
do
oh,
people think that, or
yes,
so
it
you
is still taught in
okay?
some programs. It is
Really?
health. I've heard healthcare providers say massage will spread
Oh,
cancer because the belief is be and there's not, to be fair, a lot of definitive studies about this, but the assumption is getting a massage might boost your circulation, got your blood, your
mhm.
lymph moving, and
Or
because
you might be pushing on a tumor and
well,
causing
so
it to
that is the
spread.
one no. We don't push, like you don't squish a tumor, but for a lot of reasons.
Right.
Like if you, it wouldn't feel good. There's a lot of reasons not to. But because the blood is moving and if there's cells moving in the blood, that massage could exacerbate that. Fortunately, now you're a doctor, you can help me. I think our blood is still moving. Like I have not massaged you. Has your blood continued to circulate
It
during this
continues to
conversation?
circulate.
Oh,
Yes.
thank God. Okay.
Yes.
And if you take a hot shower
But if
or
it's
if you
yeah,
walk,
but if the tumor cells are already in the blood, then the massage is not going to cause it to go into the blood or cause it to spread.
right.
Yeah.
And other things make our blood move, which is very helpful because I think we need that.
Yes, it's very good.
Yes. Yes, you want your
Okay.
blood to keep moving. So that's the myth. And that's why the myth, but it's super pervasive.
Hmm.
And I hear it from healthcare providers. We hear it from nurses.
Oh my
Our
gosh.
people hear it like I don't want the cancer to spread. Like it won't. It's too smart. I mean, cancer cells are very complicated by my understanding, and that is a very simplistic view.
Yes. I mean, that would be almost like saying going for a run is going to make your cancer spread.
Right. So that's kind of that's the thing. But as far as the tumor, there's a lot of reasons not to press on a tumor site.
Yes.
And it's not that we're like squishing, but also it would
I
not
guess
be
I was
useful.
referring to
Yes.
unbeknownst to
Right.
like you're doing a massage and somebody has a tumor somewhere.
Exactly. Well, and I say that too about women, with the myth of women not being able to get a massage in their first trimester. I think, do you know how many of our clients don't know they're pregnant
Right.
and they come to us for a massage? That's a lot of people. Yeah.
Myth number 3. You're going
Okay.
to bust for us.
Oncology massage is just light touch.
Hmm.
Oncology massage can be anything as varied as people who have cancer, which could be anything from having melanoma, getting a treatment for that doesn't require maybe a chemo, but is stressful and causes other challenges. It can be as varied as working with an active parent who's dealing with cancer and their kids. It could be end of life comfort care. It is the spectrum. Simply what oncology massage is having a knowledge of cancer and all of the ways it can impact the body and the ways the treatments can impact the body and mind and how we can modify our treatment. And maybe somebody like me, I can work with people who have cancer, but there might be some areas where lymphatic drainage, I would find somebody who does it more often than me to be more effective. But I give one example is I think even for one person, an oncology massage could be different. And I think of a young mother who has breast cancer, kids at home. Maybe she's gotten massage for years. And at first, the treatment is going to change. You've got the stress, the fear, the anxiety. Maybe step 1 is chemo. So we know that somebody receiving chemotherapy is not going to be getting the same vigorous massage as somebody who is running marathons. So we would be modifying that. Maybe there's some, we need to be careful of spots on the bones because we don't want to use too much pressure that could injure a bone. Then we can maybe move on to the stage of surgery, recovery, radiation, and we've got some spots. So maybe we change our oil up. The skin might be irritated. If we're working in those spots as the burns are healing, then mix things up, use something. And then we've got our initial surgical wounds are healing, the massage might start getting more vigorous. Once the weight restriction is lifted and we've got a child, we're out of practice lifting the kid up on our hip. We've got someone who's achy from that, but also trying to get range of motion back.
So a lot of it is adapting
That's it. It's
the
not
massage to the
right.
particular.
Not a one size fits all. And I say that too because I do think, and it could be because people are afraid they'll be turned away if they say they have cancer or they've had it. I do think some people are afraid to disclose cancer or a cancer history because they're afraid it will be a light massage and not what they want. And it just needs to be a conversation.
You mentioned body image, and that's one of the issues that many patients experience especially after a surgery,
Right.
or sometimes radiation can cause some obvious dysfunction or disfigurement. What's your personal experience with taking care of patients, giving massage to women, for example, that have had mastectomy? How do they approach it with you? So you're not, in a cancer center. So
Right.
your clients may who come to you, you don't know whether they've had cancer or not unless they disclose it to you. What's been your experience with women who come for massage, who, maybe they're years after their mastectomy, but how do they generally talk to you about their surgery and their...
That's a good question. And I hate this answer because it seems way more common than I would love. For my own personal history, breast cancer seems way more common. So many of us are touched by people we love, so many of our clients at some point. So I feel like the people that we've seen have been more open about it. We are still draping, we still cover the breast tissue, even if people have had their breasts removed and have not had reconstruction. If we're working with clients who don't have breasts of any gender, we're still covering respectfully. We would do informed consent if they're getting a more medical type massage because we're working scar tissue, but we would still not be undraping the entire area. So that is something I would say what we see more of as far as people expressing a little bit of discomfort is wigs. The hair loss. Not everybody. It really depends, but there are some guests who will apologize because their wig is itchy and they want to take their wig off. And I don't know if it's because that's newer to the, I mean, that's, earlier for a lot of people in cancer. And I think that it's a sign people worry that they look, sick, and it's startling. So that's one where we have had people apologize, like, can I take off my wig? It's hot, it's itchy. Like, by all means, please. So we leave it up to each individual. But yeah, typically, I think when they come to get a massage, they know what we're about. And it could be, at least in our practice, we're really marketing to diverse bodies. And that's, it's in the motto. It's
Right.
You really can see it. If you go to our website, you're like, oh, I get what they're about. But it is definitely something that we're mindful of.
Okay. What's another myth?
All right. What else do we have? It's just a massage. I don't really need to disclose my history. That we get that on all kinds of things, right? But people who don't understand the power of what we do might choose not to put their history down because they don't understand why we would ask. They think we're being nosy, but it is really helpful to know. I mean, again, I always use my mom as the example because I have her permission to. But she chases 3 grandkids. She chases my nephews around all day. I would not have the energy. I literally couldn't do it. But if she didn't disclose these things, her challenges with bones, with arthritis, I mean, you would see it on her hands. But if somebody's going too aggressively on my mother, if she didn't put all of this down, I would be very, very concerned.
So,
for
so your intake form, do you usually ask them what their medications are?
we
And
we ask a lot of questions, and we've fine-tuned our health history form. We call it a welcome form, but it's because we want people, we can send it in advance because it also has ways that we can modify a service and accommodations that we can make, that if we don't have advance notice, we can do our best. But even things like if after a mastectomy or an abdominal surgery, we can do side lying massage. We can do massage on a table where the head will come up. We can prepare a room differently. We have a transport wheelchair for people who are tired. We have a long walk down the hall to us. So we can do a lot of things in advance, but we do ask those questions so that we know. But also, somebody might indicate something that they didn't know we could help with, whether it's a scar that's causing some challenges where maybe that's not what they want today.
Mhm.
You just, sometimes you go and you just want to zone out and you like, leave my scar alone. I just want to relax. But down the road, if that scar becomes a problem, hey, there's things we can do if you're interested.
Let's talk a little bit about the profession
Mm-hmm.
and the intersection between the government and insurance
Mm-hmm.
and credentialing. So, as we said, we're more and more we're recognizing the
Mm-hmm.
medical benefits of massage, but so far, insurance companies don't cover
Mm-hmm.
that, and part of the process of getting insurance to pay for something that might be beneficial is to do the studies that demonstrate to
Yes.
provide the evidence that this is a treatment that is of benefit,
Mm-hmm.
and then working the system, which involves licensing, but then also working with the insurance providers
Mm-hmm.
to recognize the benefits of this. So how have you what work have you been doing to
Sure.
advance the profession of massage therapy?
Well, my just being invited to speak to you and educating people about what we know, what we do, what we don't do is helpful. But you're right. Research is going to drive everything. If people want to see their massage therapy covered, research is step one. Research is going to impact money. You have to prove it's effective, because why spend money if we don't know it's effective? So that's step one. Education is step two, because there are still a lot of people who think that massage is just anybody can rub. We hear it regularly, like, do you have to go to school for this? I mean, they're shocked. Our clients are absolutely shocked. And I think, yes. And I went to school in a health profession, and the anatomy and physiology that I learned in massage school was a lot more in depth than what I learned at college, at a state school. So, yes, we do go to school. And I think that some of the people making decisions about what somebody would need for licensing don't really have experience with massage therapy. And fortunately for them, hopefully they haven't experienced cancer or a loved one with cancer and seen it firsthand. But people just need to understand the benefits so that they can see the importance of keeping a minimum standard of education. So that if somebody wants a massage, they don't have to do this whole deep dive into, well, what kind of training did you have and what all did you learn? Because the public shouldn't have to bother themselves. If I go to a doctor, I assume
Yes.
you're a doctor.
And when you're talking about the evidence, so one
Mhm.
of the areas where I think there's the most evidence showing direct benefit is in pain management.
Yes.
So, as everyone knows, with the opioid crisis, there was a
Mhm.
period of time at which the kind of the preferred solution for pain of any kind is just medication.
Mhm.
And we know that narcotics can definitely help with pain, but that there's a consequence
Right.
of using narcotics or pain medications for every pain, and that non-medical management of pain
Mhm.
can actually be preferred. And so there are
Yeah.
studies that demonstrate the effectiveness of
Right.
massage therapy as part of a non-medical pain management program.
And federal legislation, people can look up the no pain, like out of pain, but No Pain Act. And there is more moving at the federal level to encourage the research. of non-opioid options as a first-line treatment for pain. The VA system employs massage therapists, and they are increasing the number of massage therapists that they employ. There are more options for people slowly but surely for coverage. But the problem we would run into is not having licensure. And I was listening to your episode with your music therapist, and when she said, well, unfortunately, we don't have licensure. So what's really important, it's one thing if lawmakers hear from me. I'm a licensed massage therapist, so what they think is, well, you're just trying to protect us and keep people out of the field. I get that if you don't have experience. But to hear from people who have used massage therapy to say, my husband had cancer, I had this issue, I'm dealing with things like long COVID, and this is how massage therapy impacted me. And here's the importance. That's who they need to hear from. And gosh, wouldn't it be nice if this was covered? But money needs to be allocated for good research. Organizations like yours are doing great things to help show what we can do. And do you have research coming?
We are
so
doing
excited.
research, and so for that very reason, we have enrolled 60 patients in our research program, and the research is to do before and after surveys of quality of life to help demonstrate not just that a patient might say, well, I just felt good, but to actually demonstrate with evidence using validated surveys of quality of life what these various integrative approaches. So as a cancer center that is doing this without reimbursement, we feel obligated to help demonstrate, to help create the evidence by doing this research.
And that it is just so important, and I'm so excited to see more research. And it just takes people who've received massage therapy to speak up and say, this is how I'm using massage therapy, or really other complementary care, but to say this is how it's helped, because it's more than just going and getting a hot stone massage for a bachelorette party. It's a lot different than that.
Yeah, very much so. Let's do some questions. Oh my gosh, we don't have time for very many, but let's open it up to our live studio audience for questions.
Well, it's interesting. It's good to introduce stones and things like that. Now, a question I have, do you do Reiki?
At our spa, I have people who do Reiki. We do not offer it as a service at our spa. We do have people who do it. So they might incorporate it with the consent of a guest, but it is not a standalone service at our spa.
Yeah, I've had that experience. And then I touch heat. I've had that experience. This is before I got the cancer. And then when I went to her, he got a certificate, and I go, okay, I'm going to use it. She did get scared. And then she had me hold a pillow like I'm a pregnant woman, because I just had the port put on. And I understand. And I was kind of like, well, maybe we need to give the certificate to my husband and he can use it. She goes, oh no, I'm really going to try. But she wasn't trained to know that. And I didn't take it badly. It was just, I really didn't benefit from that massage because she was afraid.
Yes.
And, but I did. I started going to the massage therapy at the center. Big difference because of my lipedema and everything. But I was going to ask you, when you're talking about the scar tissues, like it builds up a lot here with the lipedema, even though I have like a pump to work on it. What kind of method would you use
for scarring?
Yes, I was curious on that one.
That's a good question. So typically with scarring, and it's different for different people, different scars. And also people's comfort, like a myofascial, a cross fiber, frictioning, based on what someone can tolerate. Certain products are more helpful with scar tissue. And then teaching somebody self-massage for scar tissue is really helpful, because the biggest thing is repetition, and learning to massage your own scars, which for people isn't always, I know I have some that make me kind of squishy, but that's going to get the most result, is to learn how to massage your own if you can reach them. Yeah.
Thank you. Anybody else?
Okay. Any other questions? We have got time for one more. Sure. George.
I'm I'm particularly interested in sports massage
Sure.
for athletes.
Mhm.
I would think that massage is good short term, but runner's knees. I've got runner's knees. I mean, can you alleviate that, and can you actually cure it, or is it just therapeutic?
This is a really good question because I'm a runner, and a lot of us that are active don't want to tell people to stop being active. We want to help you figure it out. We can't cure everything. I do tell a lot of my guests I can help alleviate some aches and pains. I'm not always the answer for people. What you're describing, I like to refer to physical therapy, or I use Pilates too when I have problems with my knees, my hips, to help. I think we focus a lot on flexibility. I don't think we focus enough on strengthening things to help us stabilize, like knees, pelvis. So I will say I can do what I can do, but here's a few good options for physical therapists. Let's work together to not only stretch, but strengthen things to help protect your knees. I'm not always the answer. Yeah.
Right. Well, Cassie Sampson, thank you so much.
Thank you.
Licensed massage therapist and also the owner of East Village Spa.
Yes.
So if you know someone who would benefit by listening or watching this program, it will be available on demand tomorrow at the Above and Beyond Cancer YouTube channel, also at the Mercy Cancer Center website. I hope you'll join us again next week. Thanks. Thanks, Cassie.
Thank you.